Hi, my name is Dr. Scott Geiger, and I'm one of the board-certified plastic and reconstructive surgeons for the St. Luke's Medical Group. I specialize in a variety of plastic surgery procedures of the face and the body, including all forms of aesthetic and reconstructive breast surgery, from breast augmentations, lifts, reductions, and breast cancer reconstruction. Here at St. Luke's, we help treat and reconstruct women throughout the spectrum of breast disease, from those that have been deemed to have a high-risk genetic mutation to those that have been diagnosed with invasive breast cancer and decide to undergo mastectomy. Being diagnosed with breast cancer is an emotional roller coaster ride, and it's my job to help you see the light at the end of that tunnel. Women sometimes have to undergo a variety of imaging and biopsy procedures, and they meet with many different doctors, from the breast surgeon to the medical and radiation oncologists, and also their reconstructive surgeon. Fortunately, at St. Luke's, we have an amazing breast health team that will literally hold your hand and help guide you through this process, making it so much more comfortable and easy. Our #1 goal is to cure your cancer, but then it's my job to recreate a natural appearing and feeling breast mound and make you feel whole again. Your initial consultation is where we get to know one another. I'll review your cancer and medical histories, anticipated cancer treatment options, prior surgeries, and we'll discuss your current breast size, body type, and your specific goals as well as your concerns. At this consultation, I'll perform a thorough exam, including your abdomen, your back. We'll take a look at your breasts, as well as take some measurements to help guide our choices. Breast reconstruction is a beautiful blend of artistry and science, and I use this to personalize your options, including implants or methods using your own tissues. I'll show you examples of the devices themselves, from a variety of expanders to a variety of the latest generation implants. You'll get to touch and feel these devices, and your partner or family will too. We'll go over diagrams of the procedures and extensively discuss all of the risks and benefits. I'm a strong proponent of knowledge is power, and I want you to feel empowered and comfortable and confident in whatever reconstructive journey we agree to embark upon. Implant-based breast reconstruction is by far the most common method chosen by women in America today. It means that we'll build a new breast based off of a saline or a silicone gel-filled device. Sometimes this can happen in a single procedure right after your cancer operation. But often it's a staged procedure where first we insert a tissue expander or a medical balloon that's filled with sterile fluid at the time of your surgery, and several times thereafter in my office. This is often done on a weekly basis, and most of our patients do not have much discomfort during this procedure. Once we reach our size goal, we allow the tissues to relax and get accustomed to that newly stretched size and shape for about 1 to 3 months. We'll then exchange this tissue expander for the softer, much more natural permanent implant at a second, much less stressful surgery, and usually you go home later that day. Autologous tissue reconstruction is when we use your own tissues to build the breast. This is most commonly performed with the lower abdominal tissues, but can also be from the latissimus muscle on the back or the tissues of one's thighs or buttocks. Here at St. Luke's, we perform the pedicle tissue transfer options, meaning the blood supply remains attached to your body during that tissue transfer process. These are great options, especially when reconstructing one side while the other breast remains larger and more natural appearing. It is also a great option to incorporate at some point in time in your reconstruction if you have to undergo radiation as part of your cancer treatment. It has a longer recovery period, and as with any surgery, it has its own set of risks and benefits, all of which we'll cover in your consultation. I'll typically use fat grafting at the time of nipple reconstruction or a few months after the final reconstruction has had time to settle in. This is a technique where we gently harvest fat from one area of the body, we process it, and then deliver it in a special way so it can live in a new area of the body. We use this to fill in small contour irregularities and soften the edges. Overall, it really enhances the final outcome. Any woman who is diagnosed with breast cancer and is considering a surgical procedure has the option to meet with a plastic and reconstructive surgeon. I really encourage this because a large part of what I do is to help empower you with the knowledge about your reconstructive options and transform this scary world of wondering, what will I be left with, into a world of options and the realization that you can still look good and feel good as a proud breast cancer survivor. For more information, call 314-205-6420 or visit stlukes-stl.com.